first floated the idea of sustainability and transformation plans, it was based on the principle that we can't go on as we are at the moment. We have to bring people together, whether they work in primary care, in community health services, in the hospital sector, in local government, in commissioning groups. We actually have at our disposal a massive resource in a local community. It may feel extremely tight financially, but actually when we look around, there's not just our financial resources, but our workforce, the information we have, wider community assets, volunteers, the relationships we could build with education, with industry, with other sectors. When we think about that resource in a holistic sense, surely if we came together, we could deploy that resource in more intelligent and effective ways to really improve the quality of care and support we provide for local communities and really improve the health and well-being outcomes for those same populations. So what next? There's a lot to do. I just want to focus on 4 things for now. The first is both public engagement, patient engagement, and indeed staff and clinical engagement. It is vital over the next few weeks and months that between us we use the emerging STPs as the basis for much deeper engagement with local communities, really starting to articulate what could this mean for me? What could this mean for me in terms of my access to GP services, my access to mental health services? What could it mean if I'm a frail older person or I'm a carer for somebody with complex needs? I know that within STPs there's a lot being done already on involving some groups of clinicians and other staff, but I think there's a lot further to go. We urgently need to be able to both describe for staff how will this make my job better, how will this mean that I can work more collaboratively with other health and care professionals and with service users themselves, and am I going to be a champion for this change? The second thing I wanted to say was about how we make sure that we're agile and slick in how we start to deliver the promise of STPs. We need to make sure that these are living, breathing plans, that they continue to evolve. We need to plan for different scenarios. I've seen too many occasions, I'm sure you've seen this too, where we write plans that say, I don't know, there will be a 5% reduction in demand for non-elective care, and writing in a plan clearly doesn't make it so. And we have a slight tendency to then sort of sit rather stunned when it turns out that we don't reduce demand by 5% or whatever it is, and wonder why it's not conforming to the plan. So one of the things we're working on with a number of people is how we develop this rather more agile form that enables us to course correct if things don't go to plan. What do we do differently, and so on and so forth. The third thing, and for those involved in the contracting round, this is obviously of very much of the moment, because we've set ourselves the ambition of completing operational plans and contracts by the 23rd of December, which I know is a really tough deadline, but wouldn't it be great if we could go into the new year with that behind us? And I guess my plea to everybody involved in this is, can we try and build on the emerging success of STPs to take the adversarialism, the back and forth out of that contracting process? Let's have a really honest, open book look at the resources available to us, the financial resources available in each community, and really try and put ourselves in each other's shoes and think, rather than how do I fight my corner as a commissioner or a provider, between us, how can we use that set of resources to best effect and cement it into a set of plans. And then just finally, just a brief word on capital. Part of the reason why there's been this difficult debate about when best to launch wider public engagements is that certainly a while back we were faced with a situation where if you added up all the capital asks in the emerging STPs, they would have far exceeded both the amount of cash available and the capital limits that Treasury and the Department set for us. And there were questions also about whether the revenue consequences in future years were affordable. That is getting a lot better, I have to say. So thank you to everybody who's been involved in continuing to refine those capital investment plans. Just to finish though, thank you again for the fantastic work that I know lots of you are doing, and let's really work together to build on that early promise.